Welcome back. This is Dr. Jenkins. Here we are for our Histology number 2 lab. If you recall, in the first half of the histology, we covered epithelial and muscle tissue. And now, in the second half, we're going to cover connective tissue and nervous tissue. Don't forget that you have a lab assignment that goes along with this, where I'm going to ask you to sketch the tissue types. Don't forget that you're going to have an online histology practical, where you will be shown a picture and then you have to identify what tissue type it is. You know me by now. Of course, there will not be a word bank, so make sure you're able to come up with them just by looking at them. Remember, I said that I'm not always going to use the same pictures from here because that would be too easy. And I also said that if you just study with these pictures without realizing it, you're going to think, for example, areolar is pink. But what if it's a dyed picture that's blue? So in the first video, I gave you 2 websites to go to. One of them was the University of Kansas Histology, and the other one was Loyola University Histology. So just go to Google, type this in, and then when you go to these sites, remember, they're going to have more tissues than we're going over. So just go over the 20 tissue types that we're going over. And if one looks really different, then just bypass it. Okay, so here we go. I've saved connective tissue for the second week because it is the hardest category. You know, we talked about epithelial tissue when we said epithelial tissue has some pretty similar characteristics. In epithelial tissue, there's going to be free space. And then you can determine the type of epithelial tissue it is by the shape of the cells and the number of layers. Well, it's not that easy in connective tissue because in connective tissue, the structure really varies, okay? All right, we're gonna talk about 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 different types of connective tissues. And this is going to be you when you get an A on the practical because you work so hard. All right, so the first category is considered to be loose. And it's considered to be loose because these 3 tissue types that are connective tissue have a looser arrangement. Now, some professors will ask you to write loose connective tissue areolar or loose connective tissue adipose. For me, you don't have to say loose. You can just say areolar, or you can just say adipose, or you can just say reticular. So let's have a look. Areolar kind of looks like this. As I have before, I'm trying to share what I think it looks like. You think of some things that help you. To me, when I look at areolar, it kind of looks like these ribbons. See these thick ribbons? Or streamers maybe, so that's what I think of. But it's a looser arrangement, and it's filled with some collagen fibers, which are the thick pink bands, and it also has some elastic fibers. I apologize for the noise out my window, can't help it today. Okay, you may remember from lecture that we have 3 different types of possible fibers in connective tissue. You can have collagen fibers and or elastic fibers. Apparently I can't spell as I'm writing. Collagen fibers, let me spell elastic correct this time, elastic, and or reticular. So these are the 3 possible fiber types. In areolar connective tissue, we have collagen and we have elastic. Collagen is for strength because it's thick, and elastic, no surprise, is for elasticity. Now remember, I'm going to ask you to give 1 location and 1 function. If I was going to talk about areolar, I would say it surrounds organs or packages organs. It's also found under the skin. It's found a lot of places. We have a lot of connective tissue. Out of the 4 tissue types, this is what we have most of. And areolar is around organs, under the skin. Sometimes, if I were to give you an analogy, I think of areolar connective tissue kind of like packing peanuts. You know, if you order a package and what you're ordering is smaller than the box, they throw in some packing peanuts there. And that goes along with its function. So you can see here it wraps and cushions. It also fills the space. So we find this a lot of places, and it tends to just fill the space in between. We wouldn't want our organs to just be set apart with absolutely nothing in between. So this areolar connective tissue fills the space, gives a little strength from the collagen and a little elasticity with the elastic fibers. All right. Our second type of connective tissue is adipose, and these are our fat cells. This is one of the tissue types that you should be able to look at right away and determine that it is adipose. It looks like marshmallows to me. Big fat cells, because this is our fat tissue. So these cells are squished together. The nuclei are squished in between. You know about fat, you know about adipose. It is under the skin, it's around the organs. So pick a location, and its function, pick a function. We know that fat acts as an insulator under the skin. We know that fat acts as an energy source. Okay? Excellent. And then we have reticular. This is our last of the loose connective tissue. Reticular connective tissue, to me, it looks like tree branches on a dark, stormy night. So these would be like the tree branches coming off. What those are, actually, is reticular fibers. Reticular fibers are branching fibers. This is the only tissue type that has the fibers that form that branching network. We find reticular connective tissue in lymphatic organs. So whether you want to pick lymph nodes or spleen or bone marrow, it's found in lymphatic organs. And we can be more general, and we're just going to say it gives structure. More specifically, it's stronger structure than, say, areolar. If you know anything about the spleen, it's kind of dense and tough. It's actually tough, but it gets that toughness from these reticular fibers. All right, now let's switch gears to our dense connective tissues, and we have dense regular connective tissue and dense irregular connective tissue. Instead of the looser arrangements, reticular, adipose, and areolar, where you see more space in the background, in the dense connective tissues, the arrangement is more dense. And we have dense regular connective tissue, and then we have dense irregular connective tissue. And you're going to want to say both parts, dense regular, dense irregular. Let's look at dense regular. Dense regular gets its name because these collagen fibers, even though they're wavy, all the collagen fibers are parallel to each other. So it's considered to be a regular pattern because these collagen fibers are parallel. And these are thick collagen, so just what I'm drawing here between that is just a thick band of collagen. Now I'm going to ask you to be more specific in the function for this one. So dense regular connective tissue withstands stress in, let me go back to pink or yellow, red, excuse me. Where's my head today? Red. Withstands stress in one direction. Withstands stress in one direction. The key there is one direction. We're not talking about a music band. Isn't that maybe a couple years ago? I have no idea. But the idea here is dense regular connective tissue gives strength in the direction that the fibers are aligned. So from this picture, this connective tissue gives strength horizontally. So you see the arrows? So if I were to pull at those arrows, those fibers would straighten out and provide strength. We find these in tendons and ligaments. Tendons join a muscle and a bone, ligaments join bone to bone. And the idea with that is that they're only going to withstand stress in one direction. A ligament is very strong, but it's only very strong in that one direction. Now, let's contrast that to dense, irregular. In dense, irregular connective tissue, there are still collagen fibers, but they run every which way. Some collagen fibers run that way. Other collagen fibers run this way. Other collagen fibers run this way. So the collagen fibers are aligned irregularly. And because they are aligned irregularly, they can provide strength or can withstand force from multiple directions. Can withstand tension from multiple directions. If you remember, dense regular connective tissue can withstand stress from one direction. It's very strong, but only in that one direction. Dense irregular can withstand tension or stress in multiple directions. So no matter, let's say that I pull on this tissue this way. Well, there's a collagen fiber aligned in that direction to give me some strength. But I could also pull on the tissue this way because there are collagen fibers aligned in that direction. So it's not as strong overall as dense irregular, but its benefit is that it can withstand stress from many directions. One example of this is the dermis of the skin. The epidermis is the outermost layer of the skin. And let's see if you're paying attention. The epidermis is made up of stratified squamous epithelial tissue for protection. But the next layer down is the dermis. And the dermis of your skin is made up of dense, irregular connective tissue. And, if you pull up your skin, you can move it around from side to side, and it's strong from all those sides. The reason why it's strong from all those sides is because it has those fibers going in every which direction. Dense, irregular connective tissue. All right, we are moving right along here. Next, we have cartilage. You've all heard of cartilage, but now we're going to determine the 3 different types of cartilage. Hyaline cartilage, elastic cartilage, and fibrocartilage. Now, when you write this on your practical, you're going to want to make sure you say hyaline cartilage, elastic cartilage, or fibrocartilage. You just don't want to say hyaline. I want you to give me the whole thing. Okay, now as a group, I'm going to give you a characteristic that I think helps, all right? So all 3 cartilage types, here is hyaline cartilage, here is elastic cartilage, and here is fibrocartilage. All 3 of them have what I say looks like eyeball cells. So let me switch to black, might be easier to see. So if I circle a cell here, it has a dark nucleus and then surrounded with some lighter color around it. So to me, it looks like an eyeball. Look at this one. These look like Halloween eyeballs, don't they? In this case, the center is lighter and the outer part is a little bit darker, but still it's a different color in the center versus the outer part of the cell. And then in fibrocartilage, we have little beady eyes, where again, the inside is dark and the outer part is lighter. That's how I think of this. So when I see cells that look like eyeballs, I'm going to automatically think cartilage. And then I'm going to be able to run through the 3 types to figure out, well, is it hyaline, elastic, or fibrocartilage? Now to make my point, I'm going to go back to another cell type. So these have what I call eyeball cells. Let me go back for a minute to dense, irregular connective tissue. Look at the cell. It's all dark, no eyeball. Dense, regular. Look at the cell, all dark. And that's really true for all the tissues we've discussed so far in epithelial tissue, muscle tissue, areolar, adipose, reticular, dense, regular, dense, irregular. Hopefully that helps. Maybe there's something that comes to mind for you, but they have eyeball cells. Now, once you identify they have eyeball cells and you know they're cartilage, now we're going to think about, well, what type of cartilage? Hyaline cartilage has a smooth background. So you can see the background here is smooth. So if I see eyeball cells and a smooth background, I'm going to think of hyaline cartilage. We have this a lot of places, so you can just pick one. The nose, the outer covering of the trachea, the costal cartilage of the ribs, covers the end of long bones. You can just pick one. And the function of cartilage is really cushioning. It's an easy way to remember it, cushioning. So it's located in places where we might need a little bit of movement. Think about the cartilage between the ribs and your sternum. You want a little bit of movement, but not a whole lot. So it can give a little, and it gives some cushioning as well. All right, eyeball cells, smooth background. Elastic cartilage has the eyeball cells, and then it has elastic fibers. See these thin, spindly fibers? They're elastic fibers. And so if you think elastic fibers, we're going to think elastic cartilage. This is really more about maintaining shape or flexibility. And the best example of this is our outer ear. So we don't really get much strength from this type of cartilage. It's more about maintaining shape. If you've ever wondered why on earth we have that cartilage on the outside of our ear, it's to help funnel sound waves into the hole there. But that is all about maintaining shape. Lastly, we have eyeball cells with thick cartilage. So it's not eyeball cells with a smooth background. It's not eyeball cells with elastic cartilage. It's eyeball cells with thick fibers. And because we have these thick collagen fibers, this is the strongest cartilage. We find this in the intervertebral discs between our vertebrae. We find it in the discs of our knee joint, or if you've heard of the meniscus. And this really gives, I think it's best to say, shock absorption. So think about the intervertebral discs. We really need to have some shock absorption between our vertebrae. I said spinal cord before and I was mistaken. These are the discs between our vertebrae. Okay, so eyeball cells with thick fibers found in the intervertebral discs between the vertebrae, and it functions to do shock absorption. Lastly, our last two connective tissues, we have bone and blood. These look very, very unique. Bone has these circular radial looking things. They look like tree trunks. No other type has that look to it. So you should automatically see this and think, oh, it's compact bone. We know about bones. I'm not going to ask you about location because bones are, well, they're in bones. But you can pick a function. It gives support. It allows for muscles to attach to them. It has bone marrow inside where blood cells are formed. And then no one should miss blood either. Blood has the smooth background with the red blood cells, the white blood cells. The location is that they're within the blood vessels and they transport stuff. All right. Last one is nervous tissue. Again, this looks unique. To me, it kind of looks like a kite with a long extension. Nothing else looks like that. We know where we find this: brain, spinal cord, motor nerves, and it transmits electric signals or transmits nerve impulses. All right, excellent. Now I want to go back because in the first video, I told you that there's also something online that is a tissue practical review. So it's the same pictures from the PowerPoint, just in all mixed together. So this can be a good way to study because it mixes all different types. Right here we see cardiac muscle, then we see areolar, connective, bone, blood, transitional epithelium. This would be elastic cartilage. This would be simple columnar. I brought this up because I want to point out 3 that are commonly missed, and they're right in order here. So here we have dense, regular connective tissue. Remember, it's thick collagen fibers. Even though they're wavy, they're parallel to each other. Then we have smooth muscle. And believe it or not, if we change the stain color and they were both pink, it can trick you a little bit. So I'm pointing out the ones that we are missed most often. To compare them, smooth muscle is straight, whereas the dense regular connective tissue is wavy, okay? So pay special attention to dense regular connective, smooth muscle, and lastly, dense irregular. Again, if we change the color, this dense regular connective tissue, actually, yeah, if you change the color, it can sometimes fool you. All right, so I'm just saying dense irregular, smooth muscle, dense regular. These are the 3 that tend to be missed most often. And another one, now that I think of it, let me add a 4th one, and then we'll be done. You're going to be glad you stuck around to the end of this presentation, though, I promise, if I can just find it. Fibrocartilage. Sometimes fibrocartilage can be mistaken for smooth muscle. Okay, and I'm not going to go back because I don't want to make you motion sickness from keeping on moving. So this is fibrocartilage. And if we had the same stain color, it can be tricky. The difference, though, is fibrocartilage has rough edges. So if I look here, they're kind of wavy edges, aren't they? Whereas smooth muscle, all the lines are smooth edges. All right, folks, study, study, study. If you have any questions, let me know.